The Lions Diabetic Retinopathy Project, Southwestern Uganda, was a project funded by the Lions Club International Foundation and the Church of the Latter-day Saints. The project was run by Mbarara University and Referral Hospital Eye Center in Southwestern Uganda with the aim of ensuring that no one goes blind in the region due to diabetes.
In 2014, we conducted a research in the main hospital here in Mbarara. And this research was conducted among people who have diabetes. We found out during that research that diabetic retinopathy was one of the main leading cause of blindness in this group of people. Now, what was surprising to us was that only 2%, that is 2 out of 100 diabetic patients, had ever received an eye examination. This was worrying because it meant that the rest of the diabetic patients had never received an eye exam or did not even know that diabetes causes eye problems. And that's why we decided to write a proposal with our friends at the Lions Club of Mbarara to Lions Club's International Foundation for the funding to do this screening program.
We saw diabetes becoming growing into an epidemic problem in this region. And we are aware of, that among the numerous hazards that diabetes poses for human health is the problem of eyesight. And as a result, we saw ourselves coming face to face with another problem of blinding conditions. And as Lions, we have fought blindness and blinding conditions for a long time. So we saw that diabetes was bringing us back into a situation where we are going to face the similar problems that we have been fighting in the last 100 years of our existence.
The objective of the project was to strengthen the capacity of the health system to screen and treat diabetic eye disease.
In this project, it had like 2 or 3 cardinal purposes. One was to screen patients for diabetic retinopathy, and then we refer them for treatment at the Mbarara University Regional Referral Hospital Eye Center. This we have achieved probably 100%.
You know, the major impact, the major thing that the project has brought to us and patients is starting that screening program for diabetic patients. It's the first treatment protocol. If you get a patient screened earlier and is seen earlier and is started to be managed earlier, he or she might not even need to go outside.
In the course of project implementation, a lot has been done in the community to educate the masses about diabetes and how it affects sight.
The second objective was to create awareness among the population that actually diabetes causes a disease called retinopathy or diabetic eye disease, which is a potentially blinding condition. And once you don't arrest it early and the sight is impaired, it's normally very difficult to reverse.
The number of patients coming with diabetic retinopathy has increased, almost doubling. We used to have about 20 patients in a week, but now we are seeing more than 100 patients coming on a weekly basis for diabetic retinopathy screening.
We have been doing a lot of sensitization. People are coming, you can see how the hospital is here full. Formerly it used to be empty. Partly they are not only coming for diabetic retinopathy, but because of the sensitization, when we are sensitizing, we are not doing it only for diabetic retinopathy. That is almost the last part of getting blind. So if they don't treat, now I'm happy that this project has brought more people to the different health units, and we believe it will be sustained in that way. But the best thing is that people are aware, they have people to look after them, the trained personnel, and the equipment is there.
The project put together technical teams around the region to screen patients, create awareness, train health workers in the public health units about the disease so that they are able to detect it and refer these patients to Mbarara University and Referral Hospital Eye Center.
In this regard, we had a lot of stakeholders, and therefore many other people got to know about this project and helped us along. And I would like to say that we had an excellent team all along. Our internal team as project operations people, but also other stakeholders, the Lions clubs out there, the health workers, government and the private, non-for-profit out there, who worked with us in all the regions where we did screening camps and referred patients to Mbarara.
The project was implemented in 3 major aspects: human resources training, infrastructure development, and service delivery. The human resource training element of the project was focused on building capacity of health workers in dealing with the disease in terms of screening and treating the disease.
The third objective was to train health workers in the public health units, health center 3s, 4s, and the larger hospitals about this problem, so that in their day-to-day care of patients, they're able to recognize these patients and refer them for treatment.
During the course of the project, one retina surgeon, Dr. Ruvuma Sam, was taken for training in India, while 5 new ophthalmic clinical officers, 17 ophthalmic assistants, 17 OCOs refresher course, and 100 staff were given cascade training in 17 districts.
We have trained a number of personnel, both at Murek here and within the region.
And in this regard, we happen to train the first diabetic retinopathy surgeon in this region, Dr. Sam, who is stationed at Mbarara Regional Referral Hospital Eye Center here in Mbarara.
I got a chance, and I was funded by the Alliance Project to go and do that subspecialty or fellowship in vitro retinal surgery. I did that one for 1 year and then came back here. So it has been quite interesting, because now I can really, first of all, I attained that title. That's my own benefit. But most especially the patients, because it has been now very interesting, so that I can now treat those patients. At a certain level, I cannot do it completely because there are some things which are still missing. We haven't started doing surgeries here, but there are other treatment protocols that we can now do, which doesn't need to send a patient to Mengo, and then patients have been benefiting. So this project, one, as an individual, I've gotten that. My dream come true because I always wanted to have that as a VR surgeon. 2, it has added on my academic qualifications. But now, to the part of the patients now, we can really try at least 70% of those cases can be treated from here. Or maybe 80%, or maybe 20% are the ones that we can send for others, for those surgeries. Which you also think that very soon, I don't know, I cannot tell when, the specialty clinic can be completed, and then we start to do surgeries here.
The eye unit of the hospital also received retina theater equipment like retina cameras, a service outreach van, and diagnostic kits to support the existing hospital infrastructure in the fight against blindness. With these gadgets, the hospital is well equipped to screen the increasing number of patients that show up at the hospital each day.
From the perspective of the hospital, this project contributed a number of equipment which has improved in both the diagnosis and management of patients with diabetic retinopathy. We have received equipment both for scanning the eye. The project has also helped us to provide sustainable electrical supply by giving us a generator which has helped us when power goes off.
In the course of the project, the unit has carried out community awareness campaigns in many areas in the region, interacting with people in communities with eye disorders, screening for diabetes and diabetes eye disease, training health workers in local health centers to diagnose eye disorders and refer patients for treatment at Mbarara University and Referral Hospital Eye Center. The project carried out several health camps where 23,549 people were screened for diabetes. There were 9,461 DM patients who were screened for diabetes eye disease, and about 900 were referred to Mbarara University and Referral Hospital Eye Center for further treatment. Dr. John Onyango, the head of the eye hospital at the Mbarara Regional Referral Hospital, says that the project has helped his unit in improving service delivery.
We are quite grateful for that, and this has not only been because of the equipment we have, but also other patients who are not having only diabetic retinopathy. We have seen patients number generally increased. We used to have about 800 patients per month in this hospital, but now we are seeing more than 2,000 patients on a monthly basis with various eye conditions. And this has been because of the improved service delivery brought by this project.
During one of the health camps organized by the project, Chasimile Joy, a resident of Retamo in Chirhure district who had been diabetic for over 10 years, discovered that her left eye lost its sight.
Amazina nibanyita Chasimile Joy. Nindiga Retamo. Kumanya ngo ndwaire shukari nkawoma akanwa natandika kushesha narya navuga kwiguta ko nagire mu irwaro bankwata mu shukari nashise imyaka 10 amesho nkandi yaho nshitami navuga kweza ijoberi navuga kweza nareba uruko rwatimba tukoneisha bashomise namba nahwezaho eryo ya buryo ndio ryahwezaho nyugutina kandi rya mushotene kiri yareba hatukubaza kurya kubampa amashukari bashange rya birumene hatukubantwara kurya kubantu mu kitara bashange ritakweza hatuko naho kubanyayo niko kungambara ngo nzembara batere mu kitara ngo kitara nje cyarashemeza
azabaye ngo garmuke butokozi ngo imitsingu imiterwire abo bashukari bajya mu Mbarara University urwakano rukwija naza kweteka nsondonde sente den urwakana kasheshe kare mbe nashyira University.
Actually, I didn't know I had retinopathy at its inception. I only came to know after some time, maybe a year later. I saw my vision was not clear. So when I went to my doctor said, since you have diabetes, you could be a potential client for diabetic retinopathy. So she referred me here at Murik, and when they tested, they found I was indeed a diabetic retinopathy patient. That is about 2 years ago.
According to the project chairman, Bernard Kakohichiri of the Lions Club of Mbarara, the project is a self-sustaining project that will outlive its funding time and continue to help communities address any eye challenges now and in the future.
This was a project supported by the Lions, and we have called upon many people to join the Lions so that we can always look for more projects. For instance, we are closing this, we are starting a comprehensive eye care project in Kigeza region. It is an offshoot of this, and I think with more people joining Lions Club, we'll be able to do more projects and even sustain this one. That is one way of sustaining what? Such a projects. But we are also calling upon other development partners and the government so that these equipment we have put in these health units are not left for no use. But also we are appealing to the government that if such a project is to be sustained, let them not simply transfer personnel. You train like a nurse, an ophthalmic nurse. Then you hear they have taken him or her for to do injection. Now that becomes a very big problem. We hope that we are appealing upon the government. Sustaining such a project, it is not only work of the Lions. It will be basically, for us, we gave them like what you could call seed funding. They are the ones to go ahead. Some policies at times need to be, you can say that treatment in Uganda is very free, but you can't sustain such a machines and equipment here. So there is a need for a certain fee to be charged so that such equipment that has been donated basically can be sustained. Otherwise, some projects might close if the government does not come in and even other partners do not come in to sustain such a good projects. So to me, that's where I think we need to have an emphasis. But for us, we have put basically the baseline. We have equipment, we have the personnel to run them, and we have even done a lot of sensitization that people can keep, the structure is there, it can keep running. So to me, if all those are attended to, the project will be well sustained.
By and large, this project has met its target and its objectives because very many people have been screened, they have been educated. We have also educated health workers, trained them, supported them and equipped them so that they are able to do their work as efficiently and effectively as possible.
As a department, we are very grateful to the Lions Club International and the Lions Club of Mbarara for their support to this department, for bringing service for our people. Our people used to go to Mengo Hospital, to Kampala for eye care services, but now most of the services which they used to go for in Kampala are being provided locally here in Mbarara, thanks to the Lions Club International for their support to this department.
We are extremely grateful and we acknowledge that this project would not have been possible without a generous support of our partners. And so on behalf of everyone, I would want to thank the generous partners who have supported this project. The Lions Club's International Foundation, the Later Day Saints Charities based in the US, but also our local partners, the Lions Clubs of Uganda, the Lions Clubs of Mbarara, and all the different clubs in this region. And also, we thank the Ministry of Health of Uganda for giving us an enabling environment and support to deliver on this project. We acknowledge the 17 districts in Southwestern Uganda. We thank the district health officers who have been very supportive, the LC5 governors, and all the local district leadership. And also, we want to thank the university, Mbarara University of Science and Technology, who have supported us right from the beginning of writing this project and implementing it.